Hello, everyone. Welcome to our webinar, Keeping Students, Staff, and Teachers Healthy and Safe at School. I am Rochelle Davis, President and CEO of Healthy Schools Campaign. Today, we are going to be discussing some of the enormous challenges facing schools as they begin this school year, whether it's in person, virtual, or both. Before we get started, I want to acknowledge what an unprecedented time this is for those we entrust with ensuring that our children can learn and thrive in a healthy school environment. Thank you to the teachers, school principals, school nurses, building engineers, school staff, and families that are trying to do their best to support our children. Before we move on, let's take a moment to get familiar with our GoToWebinar platform. On the screen, there are some tips that will help ensure that you have the best viewing experience. While you take a moment to adjust your settings, I'm going to share a bit about our plans for today. This webinar will run for approximately 1 hour, and a recording of the webinar will be available to view later. We are going to save some time for a question and answer with our speakers towards the end of our hour together. You can ask questions by typing a question into the questions box located on your control panel and clicking on the send button. Don't wait. Feel free to send questions through the question box at any time during the presentation, and we will answer them at the end. I'll be back to help with those questions in a bit, but now I would like to introduce the moderator of today's webinar. Please join me in welcoming Joaquin Tamayo. Joaquin is a senior policy advisor at EducationCounsel. He is also a Healthy Schools Campaign board member, a former teacher, principal, and federal policymaker. Welcome, Joaquin.
Thank you, Rochelle. Hi, everybody. My name is Joaquin Tamayo, and I'm pleased to be here today for this important conversation. I echo Rochelle's comments about what an unprecedented time this is for all of us. We're so pleased to have you here today, and thank you for joining us. Healthy Schools Campaign works at the intersection of health, education, community, and sustainability. And I know that all those aspects of our work will be part of today's event. The magnitude of the coronavirus pandemic exposed the importance of schools as community anchors that children and families rely on for much more than education. It has also exposed the inequities upon which our education and health systems are built. It's clear that we need significant federal investment and leadership to truly weather this crisis. Without this, the work of ensuring that schools are safe and healthy for students and staff is unfairly falling on the shoulders of schools alone. Healthy Schools Campaign has been working to support schools in creating the conditions of student health and school wellness so that all students can be healthy in school and ready to learn. Our work has covered many areas, from healthy school food, opportunities for physical activity, healthy indoor air, green cleaning, green schoolyards, and expanding physical and mental health services. Before COVID, school faced challenges in making sure that students had the opportunity to be in school that supported their health and well-being, and Healthy Schools Campaign has been working for almost 2 decades for supportive policies, new funding, and innovative partnerships to support that work. Since March, we've been working to support schools in meeting their new challenges in every way we can. Today's webinar is an opportunity to learn a little bit more about how COVID is impacting schools and to hear about Healthy Schools Campaign's work in these areas. Last spring, when Kaiser Permanente invited us to participate with them and others in developing a comprehensive playbook to support schools in the challenge they face in supporting student and staff health and wellness, we jumped at the opportunity. The end result was a well-organized, informative playbook called Planning for the Next Normal at School, Keeping Students, Staff, and Families Safe and Healthy. And the response from schools and others has been amazing. As of last week, the playbook has been viewed or downloaded more than 7,800 times. Today, you're going to learn more about the playbook. Then, you will hear from 3 speakers who will focus on specific challenges facing schools, delivering health services, including delivering health services, cleaning and disinfecting, and providing school food. The Healthy Schools campaign has vetted resources and created a curated list to help schools, parents, educators, and cleaning staff think about how to return to school with a focus on health and wellness. You can find that list on our website. Now, I'd like to introduce Flora Daniel. Flora is the National Project Manager of the Thriving Schools Initiative at Kaiser Permanente. As I mentioned, Flora is going to provide an overview of the planning for the next normal at school playbook. Welcome, Flora.
Thank you, Joaquin, and thank you, Healthy Schools Campaign, for the invitation to share a brief overview of the planning for the next normal at school playbook and supporting resources. I hope that you'll find the overview of the playbook and supporting resources as an integral tool to support the health and well-being of the school community this year. All right, next slide. Okay, and we can actually jump right into the next slide. So before I dive into the framework and strategies and resources of the playbook, I just wanted to share a bit of a background on Kaiser Permanente and Thriving Schools. For those of you who may be unfamiliar with our work, Kaiser Permanente is the nation's largest integrated healthcare system, providing coverage and care for over 12 million members in 8 regions across the country. We are committed to health and creating communities where people can be healthy in the places they live, learn, work, and play. Next slide. At Kaiser Permanente, we understand that health and education are inextricably linked, whether learning takes place in person or virtually or a hybrid of the two. We understand that schools are a critical institution for influencing health outcomes. And with that understanding, Kaiser Permanente created Thriving Schools to support the physical, mental, and social health needs of students, staff, and teachers. Next slide. So as it was mentioned before, at the start of the pandemic, Kaiser Permanente, Healthy Schools Campaign, and a host of national school health partners came together to create a resource to support the school community during the COVID pandemic. And you'll see on the screen is an overview of the playbook framework, which is created to address the total health needs of the school community, so students, families, and school staff. Each chapter provides 5 starter plays or strategies to support optimal learning, whether in person or virtual. The playbook emphasizes opportunities to leverage the expertise of school staff, such as school nurses, physical education teachers, and other health and wellness experts in the school community to help develop a COVID prevention and well-being strategy. Knowing that there's a lot of experts that are involved in the school community, we really want to emphasize the opportunity to leverage their understanding as the school operations and systems and planning procedures are created. The playbook also highlights the importance of making sure that all school staff understand and are trained on COVID-19 safety procedures, and also keeping families informed on the current safety measures that have been put into place to keep students and school staff safe. In addition to COVID-19 prevention strategies, the playbook provides actionable strategies and resources to ensure that students and families and school staff have access to critical resources during the pandemic. We know that there are quite a few folks who are figuring out new ways to gain access to some of their fundamental needs. So we are offering strategies and resources to provide connections to food and housing security, as well as access and support for mental and physical health services. All right, next slide. So the strategies and resources that are listed and available in the playbook are informed by the expertise of over 30 school health organizations, including Healthy Schools Campaign, who supported the playbook by co-authoring the COVID-19 prevention chapter and informing the playbook with a policy lens. The playbook also includes priority considerations for equity, inclusion, and diversity, as well as family and community engagement. The playbook acts as a repository of resources linking to a variety of national resources from our contributing partners and others, addressing and providing actionable steps to support the mental and physical well-being of the school community. Next slide. So to get familiar with the playbook, you can visit the Thriving Schools website, which I think is linked and available in the chat box. And on the website, you can view and download the playbook and also access the supporting implementation resources. You'll find short little snippet chapter videos with the experts, really diving into each chapter and the actionable strategies available, as well as you'll have access to download a chapter checklist that highlights each strategy or starter play available in each chapter. And you'll see a kind of a snapshot of what that chapter checklist looks like to the left. And the chapter checklist is a great opportunity and starting place to share the playbook resource with your school community. So feel free to download the chapter checklist and share that around your school community. So with that, thank you for the opportunity to share a brief overview of the playbook, and I'll hand it over to Joaquin.
Thank you, Flora, for sharing that incredible resource with us. As I mentioned earlier, we're going to hear from 3 more speakers today who will each present on a topic related to one of the chapters in the playbook. First up is Lena O'Rourke. Lena leads O'Rourke Health Policy Strategies and has been working hand in hand with Healthy Schools campaign on national education and health policy initiatives. Lena, please join us.
Thanks, Joaquin, and thanks, Rochelle, and to all of you for giving me the opportunity to speak to you today. I'm not going to use slides. I'm just going to tell you a little bit about the story about what schools are facing in terms of school-based health services and the delivery, both remotely and as kids come back to school. And I think a lot of it's going to sound super familiar. I think we're all experiencing this in different pieces and certainly reading about it in the press and as we go. Because the reality is millions of children across the country rely on school-based health services for their preventive and ongoing health care, including physical, behavioral, and mental health services and the management of chronic health conditions. And the unprecedented school closures that resulted because of the pandemic really revealed the extent to which schools function as an essential component of a comprehensive healthcare system, particularly for those children who have chronic conditions and for other vulnerable children. The pandemic has done a great job of raising the awareness of what's really happening with school health service and what a foundational role schools play in this delivery. But it has also put a really acute urgency on finding out how to do this and how to serve these students during the crisis. It's also an opportunity to figure out in the short and in the long run, how to really strengthen and preserve school health services. So what has happened here? Well, in response to the closures, schools, states, and federal policymakers had to quickly pivot. As students were at home due to the shutdown, they had to make policy and regulatory adjustments to ensure that school-based healthcare providers were allowed to deliver the services remotely, that students could receive the services remotely, and that payment systems, importantly including Medicaid, were there to help finance this and to make it happen. And to a large degree that happened, but there were a lot of challenges and a lot of barriers to actually accessing these school health services. Some we've sort of solved for and some remain, and it's really been a district by district and state by state response. So I'm going to talk through some of the challenges schools faced, and I do think most of these will resonate, and you've heard of this or experienced this in your own schools and in communities. So one of the first things we struggled with was how to do this? How do you connect providers and kids to actually deliver the services when services are being delivered remotely? And many school districts quickly embraced telehealth. But not all districts or providers or students had or have the capacity or the technology to make the telehealth work in practice. The lack of technology and software, challenges with broadband, particularly in rural communities, for both the student and the provider, made delivering telehealth a little tough, and it continues to be a challenge there. But when we even could figure out how to do the telehealth and to do that remotely, there were challenges around how best to deliver these services through telehealth. What are the best practices for doing some of the in-person services? How do you do hands-on modalities remotely? And how do you ensure that both students and providers have the safe and confidential space in which to practice these services? On another lens, schools were grappling with how to ensure that kids get the services they need. For example, districts have really experienced difficulty in meeting the school health services and students' IEPs. This also included, as we approached the new school year, how to get the IEPs recertified and put in place for the new school year, which led to a whole lot of paperwork barriers as well. Because to serve students through their IEP and to bill Medicaid, districts need certain amount of paperwork, including in many cases written parental consent. And this has been a challenge to operationalize in a remote setting. How do you get a written consent when you can't get the parent to sign the form? Schools and districts have risen to that challenge, but it has been a struggle in many places. Now that schools are coming back online, districts are figuring it out a little bit and figuring out how to get the kids back in school safely. They are now beginning to pivot to all the challenges we just talked about, but also how do you do contact tracing in schools? How do you meet the increased social and emotional needs of these students who are coming back to school? And in the face of very likely big budget cuts that the districts are facing, now more than ever, we need the school health providers, but that sits a little bit in balance as we figure out how to do all of these pieces. So that makes reimbursement and paying for all of this a challenge. And one thing that I work on is how we get federal healthcare systems to pay a little bit more, to lean in a little bit more to make school health services sustainable. We've been looking a lot at Medicaid and the role it can play in paying for services to low-income children who are on Medicaid. To be clear, all of these challenges, while difficult and barriers, we figured out bits and pieces of it. Districts are making this work, although the response looks different in every school and how they are doing school health services. We know that as schools reopen, the challenges will change and each district will face different things. But from a state level, states have a lot of flexibility to make strong policy choices to support school health services, including removing barriers on telehealth, making it easier to get remote patient consent, and funding and really staffing contact tracing in schools to help schools reopen safely. States can be nimble, they can be responsive to the needs of the districts, and they can really put in place a strong policy ecosystem that supports school health services. Districts too need to really seize on this opportunity. There is no one-size-fits-all solution for getting kids the school health services that they need, but there are lots of choices within the state policy construct that can really help mitigate some of the challenges and really get to the point which is making sure that school-based health providers are able to serve the kids. Also, and as I begin to wrap up here, it's important to know that we do see this as an opportunity to put in place great policy for the future. So that includes looking at what has really worked, what barriers were problems before that were exacerbated by the pandemic, that in turn we can smooth over for the future and we want to do. So looking at this as an opportunity, there's a lot we can do. We should work together to lift these issues up, to make your voice heard and to share your story. encourage school health providers and support them through asking questions at school board meetings. Build strong partnerships in your community and in your state between education, Medicaid, and public health, and encourage cooperation and coordination across all of those. And make sure you become vocal advocates for school health services so that we can safely support students and providers as they return to school. And with that, I will wrap up and turn it back to Joaquin.
Thank you so much, Lena. I want to just put a fine point and encourage everybody again to go to our website, go to the website, look at the playbook. And Lena, you're so right about the barriers and challenges that so many people have faced in responding to the new reality that the pandemic has caused. And I hope that the checklist in particular across the different dimensions of the playbook can really help people address, understand and address those challenges and barriers effectively moving forward. Next, we're going to hear from Kim Thomas, Senior Director of Services over Facilities Management at the University of Georgia in Athens, Georgia. Previous to her current role, Kim was the Executive Director of Plant Operations at Clark County School District. She is a past award winner of the Green Cleaning Award for Schools and Universities and is a current member of our Healthy Green Schools and Colleges Steering Committee. Her experience overseeing facility programs at both higher education and K-12 institutions and her longtime commitment to green cleaning makes her the perfect person to share a bit about safer disinfection in schools and how we can best protect the health of our students and staff without harming the environment. Kim?
Thank you, Joaquin. Good afternoon, everyone. I want to say thank you to Rochelle and the Healthy Schools Campaign and Healthy Green Schools and Colleges program for inviting me to share a little bit of information about what we're doing in Athens, Georgia to help keep our students and staff and teachers and professors healthy and safe at school. First, Athens is about 60 minutes east of Atlanta. Again, kind of give you a point of reference. I want to first stress the importance of having written plans for custodial staff and administrators related to your cleaning and disinfection plans. These plans should be written as training aids that can be referred to after training. And we'll talk a little bit more about why that's so essential in just a second. Even if your organization needs to make changes along the way during your reopening journey, it's going to be very important to have a baseline to document what you are doing and how you can refer back to that. This plan should incorporate your disinfection products, your protocols, definitely following CDC guidance on the approved disinfection products that you're going to be using in your program, where you and your staff will disinfect, and for how long. So determining the frequency of how often you are clean. For example, at the University of Georgia, we set out a 211-page guideline. And this information is located on our website, as well as you will be provided some links from Healthy Schools and Colleges. But we really wanted to be specific with our stakeholders, whether it be our faculty and staff, our visitors, as well as our own custodial staff, so that they knew how many times we would be disinfecting inside of classrooms and labs. On our buses and all of the spaces in between. So that's very important. How will you disinfect? What type of materials will you use? It's going to be very key, and you want that as part of your written plan. Whether you plan on using pre-moistened wipes, microfiber cloths, and spray bottles with your disinfection solutions, electrostatic sprayers, or just writing the written guidance for any third-party contract cleaners if you don't have your own in-house staff. All of this sets up the methods and drives the questions that you'll want to be able to answer for your employees, for your parents, for your students, and for your faculty and staff. Another important question that you need to consider is who will do the disinfection? Will you only utilize your custodial staff, or will you solicit help from your teachers and staff and students and visitors? At the University of Georgia, one of the things that we very quickly realized with reduction in budgets, we don't have enough custodial staff to clean and disinfect every area of our campus. So it was very important to have a plan in place where we did plan on utilizing disinfection wipes in our common areas, and that's very key. So how you plan to disinfect is just as important on what you're going to use. But there's plenty of information to help guide you along the way in the Healthy Green Schools and Colleges Guidelines for COVID-19 Cleaning and Disinfection Resource Book. You see a copy of it here on your screen. And in there are several key points that I will point out in the chapters because we won't go through all of that. But the first chapter is create a cleaning and disinfection plan. And we've covered several of those key takeaways just a second ago by talking about making written plans. It's very key to have that. In chapter 2, it talks about ensuring that the cleaning personnel are properly trained. These plans encompass all of the touch point areas specifically. What are the touch point areas? Your staff, your teachers, your visitors, they all need to know what you consider the high touch point areas. Things like the tables, the chairs, the desks, computers, the keyboards, the mice, all of the things in between, including areas on your buses, athletic facilities, health clinics, your business areas, and all of the touch places in between in all of those areas. Training also needs to encompass not only custodial staff, but also your stakeholders. If you have teachers and vendors and visitors in your area, what types of products will you provide them for their own personal safety? And also stressing proper hand washing, social distancing, and of course, wearing masks at all possible times. So written guidance also needs to focus on these trainings for any outside areas. If you are going to have exterior learning spaces, the use of tents in areas to get people outside of the regular buildings for teaching and learning and conducting conversations and break times. So we really want to pay attention on how we document that protocol and our training, focusing also on what to do if someone is sick. How will you respond? And what types of disinfection is going to be in place if you do have a known situation where someone is sick in your facility. And making sure that your custodial staff, as well as your teachers and any other stakeholders in that building, know how to recognize signs so that they can get the proper help to them. In chapter 3, maintain sustainability and healthy indoor air. My primary guideline here is to be mindful of the disinfection products that you're using so that they are sustainable but effective. And one of the things we really focused on here at the University of Georgia, as well as in our public school system, is we don't want our custodial staff running through the whole facility like they're on Ghostbusters. So having a proper plan in place so that everyone knows what to expect is very important. And in chapter 4, communication about the cleaning and disinfection plan is very important. Having condensed versions of the plan should be shared with parents and other stakeholders so that they know what to expect and to wear proper PPE. One of the final things in chapter 5 is providing safer working conditions. And that's very key because everyone wants to know what is in their best interest to stay safe. So there's a lot more information to be said. And at this point, I'll turn it over to Joaquin for questions.
Thank you, Kim. I really appreciate that. I just wanted to share a reflection and state that not only is green cleaning so important just to make sure that our school buildings are safe and helpful for our students and our staff, but also, as you said, communicating those plans not only to student staff, but also to families is going to help to build the kind of psychological safety and wellness that is necessary for students to learn, for staff to feel ready to engage in their work, and for families to feel safe as well. So thank you so much for what you've shared. Before I introduce our next speaker, I'd like to encourage everybody on the program today to use our questions box. We're going to be turning to a Q&A in just a short time. And so if you would have any questions for any of our speakers about any of the topics discussed today, please go ahead and use that function in the GoToWebinar portal. Finally, we have our last speaker. Audrey Rowe serves with me on the Healthy Schools Campaign Board of Directors. She is the former administrator of Food and Nutrition Service at the U.S. Department of Agriculture and has spent more than 30 years working to make sure that all students, especially low-income students of color, have access to nutritious food. Going back to what Flora shared earlier, Chapter 3 of the playbook focuses on the effects of social drivers of health. There is no doubt that food insecurity has increased during the COVID pandemic. Audrey is going to talk to us about the challenges schools face in providing school food and Healthy Schools Campaign's work on this issue. Audrey?
Thank you, Joaquin, and thank all of you for joining us today. This is a very important conversation that we are having. The Healthy Schools Campaign, as you know, works on school food. And today we hope to share with you what you need to know and what you can do to support our children having access. We know that for more than 70 years, the school lunch program has served the important role of providing school meals to students from low-income families. However, during this time, the program is facing its greatest challenge, with many school buildings closed and remaining closed, and students learning virtually. School is taking place outside of the school walls, but children everywhere still need to rely on school food. School food is a top priority for the Healthy Schools Campaign, and I'm proud to be on the board of an important organization that has long championed the basic truth that access to healthy food shapes students' health, learning, and lifelong wellness habits. Right now, we're focused on the work that must be done to ensure access to school food during COVID-19 pandemic and beyond. More than 22 million children who participate in the National School Lunch Program were receiving free and reduced price lunches. However, when the schools shut down last March, USDA put into place flexibility of the Summer Food Service Program, which allows for fewer restrictions on how and where schools can serve meals and who they can serve them to. While some of these flexibilities have already been extended through June 30th, 2021, the end of the school academic year, other key waivers are set to expire at the end of this year on December 31st. If that happens, it will be exponentially harder for children to get their school meals easily. For example, there is a waiver that allows some community organizations to receive federal reimbursement to provide meals to children in their neighborhoods. If this is allowed to expire, children will only be able to get meals from the schools in which they are enrolled. For example, now imagine a family with 2 or 3 kids, maybe one in elementary school, maybe one in middle school, and maybe one in high school, going to 3 different schools every day to collect meals. That is logistically not possible for parents or for caregivers who may be working or supervising children at home and learning that needs to take place at home with their presence. Another waiver allows schools to provide meals to any student, regardless of whether or not they are enrolled in the federal program. When the waiver expires, the logistical nightmare of checking eligibility for every student in need of food will slow down the process to the extent that children may end up being turned away. This will only add to the crisis of food insecurity and hunger in this country. And think of the administrative burden and reimbursement questions, which will be overwhelming. We can't expect school administrators and nutrition directors to seamlessly transition from one way of operating and transitioning to another way come January 1st. Schools will need time to adjust, new meal service rules and try to find alternative ways to provide food to families who are struggling. Nor can we expect families to adjust to an abrupt switch. They have already had to adjust to many other switches just into ensuring how their children are learning. While many of them are trying to navigate this security network for the first time. The effects will be felt in disruptions to school food distribution, and the nation's most vulnerable children will suffer. It is critical that those waivers get extended through the end of the school year in June. It is equally critical that Congress begins to prepare for the 2021-22 school year by passing a bill that supports universal school meals so we don't find ourselves in this situation and in this crisis again. Earlier this month, after Agricultural Secretary Sonny Perdue extended some school waivers until the end of the school year, Rochelle Davies and I wrote a letter to the editor, which was published in the Washington Post, explaining why the extension didn't go far enough. We noted it just bought us time. We need a real solution. Sonny Perdue recently said that a waiver extension would, and I quote, be closer to a universal school meals program, which Congress has not authorized or funding. Well, we believe it's time Congress did. The opportunity is the Child Nutrition Reauthorization Act. It requires Congress to review and update laws overseeing child nutrition programs. It's supposed to be done every 5 years, but the last time Congress went through the full process was in 2010, when it passed the Healthy Hunger Free Kids Act. We are calling on Congress to get this done under the next administration and to improve and fund a universal school meals program. This country needs a new approach to issues of food insecurity, not a narrow, cumbersome focus on education. Under a universal school meals program, families that are skirting the edge of financial eligibility due to COVID or avoiding applying because of lack of information or other barriers won't need to worry about eligibility. At the other end, schools won't need to worry about verifying family income, spending time billing, collecting money from families who pay a reduced price for school meals. It would also give flexibility to school nutrition programs so that children could continue to receive school meals even when they are not at school. And finally, it would remove the stigma applied to students taking part in free or reduced price programs. Because when everyone participates, no one is left out. Partisan politics and inaction is having a real effect on students and families. We've all seen the long food lines. We know that children need nourishment to focus on their lessons and to improve their health and immunity. There is no excuse for not taking action that can vastly improve student health and reduce hunger. Here at Healthy Schools Campaign, we are committed to the campaign for universal school meals. You can get involved by raising your voice on this issue. You can follow us on social media and visit the school food section on the HSC website to stay connected and learn more about what you can do locally and at the state and national levels. In addition, one of our partners, the Center for Science in the Public Interest, has developed a great tool you can use to let your legislators know you support Universal School Meals Act, which was introduced last year. We'll include a link in the chat box and in our follow-up email. We hope you will join us in calling on our elected leaders to make sure universal school meals is a reality. The stakes are too high. Our children can't wait another year. Your voice can also be heard by your vote this November. Thank you, Joaquin.
Thank you so much, Audrey, and thanks to all of our speakers today and for all the tremendous expertise and insights that you brought to the conversation. We're now going to move to our Q&A session. Rochelle is going to join me to help field some of the questions, and all of our speakers will join us to respond. If you haven't already and you have a question, please enter your question in the questions box now so we can tee it up. Okay, Rochelle, hi, good to see you.
Hi.
What is our first question?
Well, thanks everyone, and thanks speakers for so much information and for doing that within your time limit, so there is plenty of time for questions. So there were some general questions and there were some pretty specific questions, but I'm gonna just start from the top. So the first one was for Lena. You mentioned that partnerships between schools, public health, Medicaid, and education are important to foster to help solve some of the issues schools are facing. What does that look like in practice? And then maybe we could also generalize that for the other speakers about what kinds of partnerships are important in the particular areas that the other speakers are working on.
I think that's a really great question for all of us because I think to achieve, at least in the school health space, the outcomes we're looking for, it is going to take these partnerships. I think in practice, at both the district and the state level, it's having conversations between education, Medicaid, and public health, who all own different pieces of this puzzle, but all with the same goal. I think one of the things that has always struck me in working on this is that often they even have their own vocabularies in how they approach some of the problems and questions, and they talk about the same problem using different words. And if you can force that conversation to happen through meetings, through having real champions, both within the agencies themselves, but also within the service delivery with advocates and parents, you begin to hear the commonalities and can braid together what those solutions really are. So it takes dedication to get the conversation scheduled. It takes constant lifting up of the barriers so people can find the pieces that fit together. And it's thinking of creative solutions in each of the buckets that the others may not know about. I mean, we've been thinking about this in the parental consent world because it's a lot of, oh, well, I can't do that. But actually, we think everyone can. And when the conversation happens between all the partners, you begin to see how the pieces fit together. So I really encourage the partnerships as a model for both the bigger picture, but also sort of the narrow barriers that every party owns a piece of. But I do think everyone here would have different visions of how these partnerships work, so I'll stop.
I can join in a little bit on that from the supply demand side with getting the disinfection and cleaning products. As we all know, a lot of us in the educational facilities area, we have had a tremendous need to get things like hand sanitizer, disinfection wipes, gloves, even masks for our own staff and certainly for our students, and masks for any visitors who might come to campus who don't have their own. To say, here you go, you need this when you're in our buildings. So just supply and demand and working out those partnerships with our vendors, with other organizations, other school districts who might be able to share. And if we're running low on something, being able to work with K through 12 schools to ensure that they have enough, where they've had some hybrid openings and they might not have all the facility, the materials that they need, working with the state so that we can get, pricing that's available to assist not only state institutions, but our K through 12 partners and private schools as well.
Did any of the other panelists want to answer? And Joaquin, I would encourage you to answer given your experience as an educator. if you wanted to.
I think I should go without saying that partnerships is so critically important. I think sometimes educators struggle to create those partnerships outside of the K-12 or PK-12 silo, as it were. So what I'm going to say, is maybe not in the playbook, but I think these times, demand a willingness of educators to think outside the box. To sometimes do what hasn't always been done in our systems, to firstly figure out how to build the real person-to-person relationships that it's going to be that are required, across our systems to make innovative and effective work possible at any level of the system that we're talking about, and to really think about how to know the folks that you need to know to get what needs to be done, to spend some time cultivating and building those relationships by whatever means you can, particularly now in our virtual world, as all of our kids and educators are finding out, the need for relationships never goes away. And that's one of the things that I think the Healthy Schools campaign has done so effectively well and modeled for our communities, is that focus on building those relationships, because those relationships lead to trust. That trust leads to a willingness to take the kind of action that needs to be taken, even if it wasn't what was done before. So as an educator, I'll just double down on the need for the relationships to make this possible. And then, crossing our fingers once the COVID pandemic, or we're beyond, this immediate crisis, those relationships will persist, and the ways that we've been working together will maintain and sustain us into what I hope is really the next iteration of an equitable future for all of our kids, where they're safe, they're healthy, they're taken care of, and they're able to achieve their unique potential in school and in life.
I'm gonna go on to the next question. This question is being asked of all the presenters to see if anyone can speak to programs or policies that are really about supporting children with disabilities during virtual learning. So if anyone can speak to that particular challenge.
I'm happy to start on this question. This is something that I do in my work at EducationCounsel, is the focus on students who are, and even more so these days, systemically marginalized from equal opportunity across our systems, especially students with disabilities. And so, I'll just remind everybody, and again, this should go without saying, but let's say it again. The students who are being most impacted by the barriers and challenges presented by COVID are, in fact, students with disabilities. We have the data showing that not only are they not showing up in terms of virtual engagement as much as other students are, but there is almost no way for many school districts and schools across the country to provide the kind of interventions that are legally and mandated required by their IEPs. And schools and educators are figuring out how to stitch together whatever services they can to meet the needs of those students. And so for all of the folks today on the line who are trying to figure out how to support particularly the mental health and the emotional health of our young people with disabilities, do whatever you can, not only to raise those concerns with your leadership, your school leaders and your district administrators, that is a real concern, and provide them, importantly, with the stories. Provide them with real information about what the kids and their families are going through, to provide the kind of motivation and inspiration that's going to be necessary. But there aren't great, unfortunately, solutions right now. I will point people to the National Center on Learning Disabilities, which does have information on how to provide effective virtual learning and support for all students with disabilities in particular. But it's a really important question. And I think that whatever people do to support our students, if you can center the students who are most marginalized from the system and get it right for them, it is so much easier to get it right for all other students.
And I'd like to add on, I mean, Joaquin's answer was much more comprehensive. I have a very little tiny slice of this, but the school-based Medicaid program does play and continues to play a sustainable role in helping pay for the services that are in the IEPs. So those health services, both the physical and behavioral health services that are in a student's IEP, they're, for a Medicaid enrolled student, the state, the federal government and the Medicaid program continue to play a reimbursement role. So that is not, you know, to Joaquin's point, that is not the solution or the answer, but it is important to sort of remember that those foundational pieces are there to support the financing, both in the short term and in the longer term. I know it's tough to figure out how to do that, and I know school districts struggle with it, but that doesn't make it less important for the sustainability of the providers who are delivering these services.
So Kim, I'm gonna focus some questions for you. There were a lot of questions really that address, you know, I think concerns about disinfecting. And I'm gonna try to put them a little bit together. I think on the one hand, some of our participants are concerned about how do you know if disinfecting practices are effective in general, but also in particular if there's a confirmed COVID case in a particular space, you know, how do you know how to make sure that that space is healthy? On the other hand, we've had some questions about concerns about disinfectants causing problems with either skin irritation or with students in asthma. Some concern about COVID being airborne and school buildings not always being properly ventilated. And so how do schools balance the need to disinfect with the concern about the lack of proper ventilation? So that was my attempt to kind of condense about 4 or 5 questions into one, but I think it highlights, you know, a concern about how, basically, to paraphrase, how do you strike the right balance for disinfectant when there are obviously inherent dangers in using disinfectants. And so I'm gonna let you try to answer that complicated question.
All right, yeah, thank you. That's a lot.
Right?
But no,
Right
but
to the heart of it.
serious, yeah, very serious questions, and you can probably spend a whole webinar just on those things alone. But as far as effective disinfection practices, one of the things that, you know, we really focus in on is using metrics guides, and we use ATP meters to ensure that gives us some level of the, not just depending on what you see, because as we know, this is nothing that you can see. So you got to have some scientific help. And we use ATP readings, random third-party assessors to assist with, along with our supervisors, doing random checks to get a baseline, and then going back and checking and teaching our own custodial staff how to ensure that they can recheck in those areas. We're also using pH strips to ensure that that the product is at the right effective level, so the efficacy is there to ensure that if we're making something that's on site, we're using our test strip to make sure that we have the right pH levels in there. And again, working with our staff, working with our building inhabitants so that they understand we don't want you bringing a whole lot of traditional products into our facilities, because that can react to what we're trying to do. We're providing them with even small containers of our Green Seal certified and EPA approved products, so that we're all trying to use the same thing. making sure they understand what are the pros and cons when they step outside of what we're doing for our disinfection and cleaning protocol. As far as looking at products with, that can cause skin irritations, asthma triggers, all of those are very important. That's why we talked earlier about not having a disinfection protocol where we're spraying everything. We spray very little, and only in confirmed areas where we have worked with that building inhabitant to make sure that area is ready for us to have a deeper level of cleaning in those spaces. And that's where we use electrostatic sprayers with our botanical disinfectant, so that we are trying to be safe but effective and making sure that we give enough time for that product to work and for that space to clear out of any aerosols that might be there, and encouraging our staff and visitors, don't bring anything that sprays to our campus. And as far as airborne issues and with ventilation, again, you know, what we've tried to do is take a very proactive look at where we can upgrade our filtration systems to the highest MERV filter levels as possible, knowing that this is, you know, a research institution, so that we're going to have some spaces where we do have to have a higher level due to clean rooms and research areas, but in our general office spaces and classrooms, making sure we have that at the highest MERV filtration level as possible. And I know with our K through 12 schools, they have put together the same protocol, because we do have that open line of communication, and we do talk and we do share equipment and information, you know, conversations, so that we can, you know, try to work as partners as best we can.
Okay. So I think we have time for one last question, barely. And so this is a general question that anyone can answer. And it's kind of a big general one. And it is, what is the most important thing that the government can do to make sure that students can return to school safely? And obviously the government can mean any level of government that any of you may choose to respond to. So I don't know, Flora, if you want to address that, since you haven't had a question yet, or but
yeah, I'm happy to kind of kick off the round of response there. I'd say, and of course, there are many areas to think about and opportunities to really enhance the support during this time. But I think one area I'd really like to emphasize is really hearing and listening to the concerns and the needs of the school community. So students, parents, educators, and other school administrators and staff, and really understanding what are their concerns and what are their needs in order to create an optimal learning environment. So, you know, what are their personal concerns, and, you know, even those kind of social drivers of health. So really understanding and listening to their needs and finding ways to implement that into kind of the operating and return and continued learning system, and thinking about that from a local government all the way up to a federal government. I think there's opportunity for everyone to listen and enhance support.
Kimberly, do you want to comment on that? Oh, I'm going across on my screen, and we'll end up being who will close us out. Kimberly, did you want to comment on that? If you don't, that's okay too.
I'll give Audrey and Lena an opportunity to respond.
Okay, Lena.
Focusing on the federal government, I think, as sort of crass as it sounds, the best way to help support school health services from the federal government is to lean in and provide more resources. There are lots of policy clarifications, but making sure that the school-based Medicaid programs are whole and sustainable takes resources, and the federal government can play a role there. I think at the state level, there are lots of roles they can play in terms of creating a strong policy ecosystem where providers have the tools they need. We remove barriers, we address paperwork issues, and a lot state governments can do as well to really create a system through which the students actually get the services that they need.
Audrey?
I think the most important is to communicate to parents continuously on what the schools are doing, what the district is doing, answering questions, being as transparent as possible, making sure that the rumors that get out and the chat that goes on in school districts is immediately addressed and correct information is provided. You know, parents are struggling right now trying to make lots of decisions and they're getting lots of feedback. But if we don't communicate clear and concise information, and to admit that that information may change as we learn more, trust is very important. And one of the ways you build trust is to communicate and share information with the children and with the families and also with the children so that they understand what is going on.
And Joaquin, you should take your crack at the question and then wrap us up.
I'm only gonna say, wear your mask. That's gonna get us back to school faster and safer than probably anything. So wear your mask. Ask other people to wear theirs too.
So that ends our Q&A session, and I'm formally turning things back over to you.
Thank you. And thanks everybody for joining us today. I want to thank our speakers, Flora, Lena, Kim, and Audrey, for sharing their time and their expertise with us. And as I've said before, these are unprecedented times, and we're inspired by what you are doing, and all of you at home and wherever you are doing to support our children's health and education. Healthy Schools Campaign wants to continue to be a resource and a meeting place for this important conversation. So please continue reaching out and letting us know what resources and changes you need in order to support children, schools, and families moving forward. As a board member of the Healthy Schools Campaign, I'd be remiss if I didn't take a moment to ask that you support the Healthy Schools Campaign and the important work that they are doing. Please consider making a donation so we can continue to ensure that children everywhere have access to safe and healthy schools. Thanks again, everybody. Be healthful and stay well. Bye-bye.